Welcome to my channel, guys. Make sure you support by liking as well as subscribing to my channel if you haven't subscribed. So in this video we're going to talk about basal ganglia. So I'm going to break it down into its simplest form so that by the end of this video at least you could have gotten something. Alright guys, let's try to make sense. Okay, so this will be our objective. So we'll talk about definition, anatomic position. We'll talk about the function and pathways of the basal ganglia. We'll talk about anatomical parts of the basal ganglia. We'll talk about the functional parts of the basal ganglia, and we'll finish up by adding clinical correlation toward the end. Alright guys, so basal ganglia by definition, it is basically a group of nuclei which is located within the white core. Okay, so within the white core of each cerebral hemisphere. Okay, then talking about the function, okay, so it is involved into the planning of movement. Okay, it is also involved into the determination of how rapid a movement can be performed. Okay, so when we are talking about how rapid the movement can be performed, we are basically talking about the direct pathway of basal ganglia. Okay, so there are three pathways of basal ganglia. So we have the direct and indirect pathway as well as the nigrostriatal pathway. So in direct pathway, it increases the movement the movement of muscles. Okay, so what happened is that if we were to refer to the basal ganglia circuit here, the thalamus will send a stimuli, okay, which is a neurotransmitter, can be glutamate or dopamine, to the cortex, which is going to improve the activity of the muscle. Okay, so the cortex, once it receives information, will send the information via a corticospinal tract to the brainstem as well as to the spinal cord. Yeah, so this is in case of direct pathway, but in case of indirect pathway basically decrease muscle tone and it increase unwanted movement. Okay, so what happens is that the thalamus will send inhibitory neurotransmitter. It can be GABA. Okay, so if it is sent to the cortex, so it reduces the activity of the muscle. Okay, so that means there will be no muscle tone, or there will be decrease in muscle tone. Okay, and then the other function is that the basal ganglia is also involved in controlling group of movement for emotion expression. Okay, and then when talking about the nigrostriatal pathway, this pathway, it is involved into modulation of these two parts. Okay, so it can be either in favor of direct pathway, that means there will be increase in muscle tone. If it is in favor of indirect pathway, there will be increase in unwanted movement. Okay, so that means there will be no muscle tone, or rather there will be decrease in muscle tone. Okay, so this is about this part. So this part is basically performed by the subsensor nigra. Okay, so we have a video on subsensor nigra. Okay, so you can go watch that one also if you want details. Okay, so coming to the next item. So the next item we'll talk about, it is anatomical component of the basal ganglia. So there are three parts of basal ganglia. Okay, so we have the amygdala. Okay, so the amygdala, this is the part which plays a role in emotion expression. Remember this part in limbic system, we said this part plays a major role in emotion aspect. Okay, and we also have another part here which is called clastrium. So claustrum, its function is unknown. Okay, so its function is unknown. And then we have the corpus striatum. So the corpus striatum, this part basically consists of lentiform nucleus and coded nucleus. So let's come over here. So it consists of lentiform nucleus and coded nucleus, and then the lentiform nucleus forms globus pallidus as well as the putamen. Okay, putamen. So the putamen together with the coded nucleus, they form striatum. Okay, so that's about the corpus striatum, which is part of the anatomical part of the basal ganglia. So now let's talk about the function part of the basal ganglia. So for the basal ganglia to perform its activity, so it has part which plays a role in function. Okay, so we have the subsensory ganglia, we have also the subthalamus and the red nucleus. So some other book included nucleus. Okay, then note that for the basal ganglia to initiate its activity, it needs to receive information from the cortex, okay, as well as from the thalamus, as well as from the subsensory ganglia and red nucleus. Okay, so it needs to receive information from 4 components. So from the cortex, subsensory ganglia, as well as the thalamus. Only that we have not included the red nucleus in this circuit. Okay, but see, the red nucleus, it has been included to say it also plays a huge role in activity of the basal ganglia. Okay, alright, so now it's important for us to understand the connection of the basal ganglia, since now we know the basal ganglia circuit. Okay, so this is the basal ganglia circuit here. Okay, so now we need to understand the connection. How are these parts connected to each other? Okay, so from cortex to the striatum, there is the fiber which are projecting here. They are called cortical striatal fibers. Okay, so cortical striatal fibers. Okay, and then from the striatum to the globus pallidus, remember we said pallidus, remember we said this is one component. It's basically the corpus striatum. Okay, so from the globus pallidus to the thalamus, we have another fibers which are projecting to here. These fiber, they are called thalamic fascicularis. Okay, thalamic fascicularis. Let me write it for thalamic fascicularis. Okay, so thalamic fascicularis, these are the fibers which are projecting from the globus pallidus to the thalamus. Okay, by the way, the globus pallidus, it is an outlet center for corpus striatum. Okay, so the striatum receive information and this is the outlet center. Okay, so this thalamic fascicularis, it consists of two pathway. In other words, the globus pallidus consists of 2 pathway, so it can send fibers to the thalamus via, there is a pathway which is called anther reticularis. So it is called anther reticularis. So you have the anther lenticularis. Okay, so we have the anther lenticularis, or we can also have the fascicularis. Okay, fascicularis lenticularis. Okay, so lenticularis. Okay, so just abbreviate it. So these two parts, they just form the thalamic fascicularis. So if you don't mind to use these names, you can just say the fibers coming from globus pallidus to the thalamus, they are called thalamic fascicularis. Okay, and then the substance nigra is also sending fibers to the striatum, and we have already discussed this in a separate video, so if you haven't watched, you can watch it. But the fibers which are coming to this side, they are called nigrostriatal fibers, so they are called nigrostriatal fibers. Okay, and this substance nigra, it can also send fibers to the thalamus. Okay, so the fibers which are coming this side, they are basically called they are basically called nigrothalamic fibers. So we just put these two names, so they're called nigrothalamic fibers. Okay, so nigrothalamic fibers. Okay, this side. Okay, so this part consists of two parts, so you can watch a video on it. It has a pars compacta and pars reticularis, so they produce dopamine in these parts. Yeah, those parts basically, yeah, they also produce GABA, so you can watch a video for details. Okay, so we have subthalamus here. It also sends fibers to striatum via subthalamus fascicularis. Okay, so subthalamus fascicularis send fibers to this part. Okay, so having talked about the anatomical function as well as the function parts of the basal ganglia, now we need to talk about the clinical correlation. Okay, so what happens if there is a lesion to this part, substance nigra? So if there is a lesion to substance nigra, someone will develop a condition called Parkinson's disease. So Parkinson's disease is as a result of lesion to the basal ganglia, the substance nigra which produce dopamine. Okay, it can be either a lesion to this part or to its fibers. Okay, because the neurotransmitter produced by this component won't reach to the target because there is damage to the fibers. Okay, so that will give rise to Parkinson's disease. So then if you have Huntington disease, it means there is damage to this part which is called striatum. So if there is damage to striatum, you end up having Huntington disease. Then if there is damage to striatum as well as the globus pallidus, collective known as the corpus striatum, then you end up having anthetosis. Okay, so anthetosis is as a result of lesion to corpus striatum. Okay, so remember, corpus striatum consists of these parts. Okay, so if there is damage to corpus striatum, you have anthetosis. And then what happens if there is damage to subthalamus? Okay, so if there is damage to subthalamus, you will have a condition known as barythemas. So this is due to lesion to subthalamus. Alright guys, so in this video we have summarized everything which we need to know about the basal ganglia. Until next time.